Hi, my name is Shani Quevedo, and I will be presenting metastatic liver malignancy leading to extrinsic cardiac compression. Cholangiocarcinoma is a malignant tumor of the biliary system that arises from epithelial cells of the intrahepatic and extrahepatic bile ducts. These types of cancers account for approximately 3% of all gastrointestinal malignancies in the United States. This is a unique case of a patient who presented to the hospital with chest pain that was subsequently discovered to be secondary to an exophytic metastatic cholangiocarcinoma compressing on his right heart. A 68-year-old male with a history of hypertension, diabetes, myocardial infarction with stents in 2006, and previously treated hepatitis C infection presented to the hospital with a history of chest pain with bilateral arm pain for 1 week duration. He also reported significant weight loss over the previous 6 months. On admission, vitals were unremarkable. His initial troponins were negative and EKG was normal. His liver function tests were also normal. Initial computed tomography or CT of the chest revealed a pathologic mass within the left lobe of the liver described as an exophytic mass causing extrinsic compression on the right border of the heart, likely resulting from metastatic disease. See image 1. An echocardiogram revealed mild biatrial enlargement. Subsequent CT of the abdomen and pelvis supported previous findings with additional evidence of cirrhosis, splenomegaly, and associated lymphadenopathy. See image 3. A CT-guided biopsy was performed and revealed poorly differentiated adenocarcinoma favoring cholangiocarcinoma. A PET scan confirmed a hypermetabolic mass in the left lobe of the liver with metastatic lymphadenopathy in the thorax and abdomen. See images 2.1 and 2.2. Patient was ruled out for an acute cardiac event and was discharged with plans to follow with oncology and begin chemotherapy on an outpatient basis. Cholangiocarcinoma is a cancer of the bile ducts and is divided into intrahepatic and extrahepatic disease. Findings of biliary obstruction are more suggestive with extrahepatic disease. Progressive malignant biliary obstruction can lead to symptoms such as abdominal pain, weight loss, jaundice, pruritus, or clay-colored stools. Given that the disease can present in later stages, oftentimes patients are asymptomatic at the time of diagnosis, with lesions being detected incidentally during workup for abnormal blood tests or screening for other gastrointestinal diseases such as hepatitis. Presentations may also vary depending on the location of the metastases, as seen in our patient who presented for recurrent complaints of chest pain without any signs of acute coronary syndrome. Cholangiocarcinoma is a common type of pancreatic or biliary cancer that arises from the bile ducts. Although the presentation may vary depending on if it involves intrahepatic or extrahepatic disease, most cases are asymptomatic and present later in the disease course when there are complications such as obstruction or metastases. As a result, a high clinical suspicion is needed along with laboratory studies and diagnostic imaging to detect this disease, especially when it presents with unusual symptoms such as chest pain. Thank you for listening.